If you've ever watched a medical drama or overheard a conversation about mysterious illnesses, you may have heard the word lupus and wondered what exactly it is. Is it rare? Is it dangerous? Why do doctors seem to mention it when nothing else adds up? Let's unravel the mystery behind lupus, an illness that's both more common and more complicated than a lot of people realize. At its most basic, lupus is an autoimmune disease. That means it's a condition where a person's immune system, which is supposed to defend the body against invaders like bacteria or viruses, gets a little confused. Instead of only targeting foreign invaders, it starts attacking the body's own healthy tissues and organs by mistake. The result? Inflammation, pain, and a wide array of symptoms that can make diagnosis a real challenge. The most common form of lupus is something called systemic lupus erythematosus, or SLE for short. When people say lupus, this is usually what they mean. Systemic indicates that lupus can affect the whole body, not just one part. In practice, this means lupus might cause joint pain in one person, a rash in another, or kidney trouble in someone else. This unpredictability is one of lupus's defining features. No two people experience lupus in exactly the same way. Some might have mild symptoms that come and go, while others might face life-disrupting complications. The most common signs are things like constant fatigue, painful or swollen joints, fevers, skin rashes, especially one that looks like a butterfly over the cheeks and nose, and increased sensitivity to sunlight. But lupus can also affect the kidneys, heart, lungs, and even the brain, leading to much more serious concerns. So, who is most at risk for lupus? While anybody can get it, lupus is most commonly diagnosed in people between the ages of 16 and 45. It affects women about 9 times more often than men, and is more prevalent among people of African, Hispanic, Asian, and indigenous descent. The exact cause isn't known, but experts think it's a mix of genetic and environmental factors. In other words, some people are more likely to develop lupus based on their DNA, but things like infections, certain medications, or even sunlight can sometimes trigger it. Diagnosing lupus isn't as easy as running a single test. Because symptoms often mimic those of other illnesses, it can take months or even years, and a lot of patience to get an answer. Doctors rely on a combination of blood tests, urine tests, physical exams, and detailed patient histories. Sometimes, a specially ordered blood test for antibodies, proteins, your immune system mix can provide a key clue. Once someone is diagnosed, the next big step is treatment. There's no cure for lupus, but it can be managed. The main goals are to reduce symptoms, prevent flares, and protect organs from damage. This is often done through a mix of medications, anti-inflammatory drugs for joint pain, antimalarials to prevent flares, immune-suppressing agents for more severe cases, and drugs like corticosteroids to calm the immune system down during a flare-up. But the reality of living with lupus goes beyond medications and doctor's appointments. Since lupus is a lifelong condition, it brings uncertainty. People living with lupus have to balance work, relationships, and daily responsibilities with unpredictable bouts of fatigue or pain. Every day can feel like a test of patience and resilience. It might mean canceling plans because of a flare, or dealing with invisible symptoms that others can't see. Fortunately, advances in medicine and growing awareness mean that more people with lupus are living longer, fuller lives than ever before. Support networks both in real life and online provide spaces for people with lupus to connect, share stories, and remind each other that they aren't facing this battle alone. For those whose lives are touched by lupus, whether directly or through a friend or family member, understanding what lupus isn't, what it isn't is a powerful first step. It's more than just a mysterious diagnosis from a TV script. It's a condition that millions of real people manage every day with strength and courage. So the next time you hear lupus mentioned, you'll know there's no simple answer. There's science, challenge, and above all, humanity behind this complicated and resilient illness. And while lupus might be the great imitator, with awareness and empathy, we can make sure it's not invisible.